The smell of rains and the puddles, we all enjoy that, but there is a flip side to it. There's a lot of chance of infections which can happen in children, and so we are focusing today's session to address this concern. We have gathered a wonderful panel of experts here who are going to walk us through just this. Our panelists are Dr. Sanjay Bafna, sir, a senior consultant pediatrician with expertise in pediatric respiratory diseases, sleep medicine, and critical care. He specializes in managing childhood asthma, allergies, and complex pulmonary disorders. Dr. Shilpa Yadav and Dr. Sagar are on the way to joining us for the session. They are both pediatricians, consultants, and have extensive experience in various childhood and adolescence infectious diseases, etc. Dr. Aarti Kamat is another panelist with us. She is a consultant pediatrician and a sleep specialist. She focuses on addressing sleep-related issues in children and improving overall pediatric health. I think it is extremely important that we discuss that aspect as well. So here we have Dr. Shilpa Yadav joining us. She is a pediatrician with extensive experience in treating a wide range of childhood illnesses and ensuring comprehensive care for children of all ages. She also specializes in adolescents and infectious diseases. So I think, and I am Richa Shukla. I'm going to be moderating the session. I'm a registered dietitian working as the head of the clinical nutrition department at Jehangir Hospital. I have an experience of more than 2 decades now. Let's get started.
They are building up the immunity against that virus. So this is upper respiratory infection, which is usually normal. You don't actually have to treat it, and probably you can take some home remedies and stay home. So that's the first thing. Now coming to infections which are really bothersome or which need some medical attention is, as Dr. Richa has said,
child who has less than 1 year of age, and usually they contact the infection from either from the mother or the sibling who is going in the school, and majority are respiratory infection. So they can get a cough and cold from the sibling or from the mother, and the newborn especially are very vulnerable to get the infection very badly, and especially if they are very small babies, like if they are born less than 32 weeks or small less than 1.5 or 2 kg, because they have an entity called as a chronic lung disease, and that can catch up the infection, especially respiratory, very commonly. Also the weaning practices usually start at 6 months, and if they get contaminated water or a food, the getting a diarrhea and loose motion is very common in these children.
Okay, and do you see any complications from this if getting untreated or probably getting severe? So what are the complications in the infants that you see?
Obviously, if they are not treated properly, if the initial time is lost, then child may end up into the complication. Especially in India, the under 5 mortality is very high, and especially in the diarrhea and pneumonia is very high. So any child, especially if it is a small, less than 1 year, you need to make sure if it is too much diarrhea, he can land up into the dehydration and even a shock also, and the urine output may go down, and there may be a problem related to kidney. And if there is a respiratory infection, it can land up into the pneumonia, and he may need the oxygen support. So the parent need to be vigilant if the baby is too small, or especially an infant. And if you get a subtle feature that baby is not doing well, and the mother is the best person, she knows that baby is not doing well, it is better immediately consult a pediatrician on that ground.
So rightly put up, when you see the child or probably the infant having diarrhea or having a lot of cough and fever, immediately rush to the doctor and get it treated and screened and treated. So next question would be to Dr. Kamat here. See, when our children catch infection, they are not just losing on the school part, they're also losing on the night sleep, their good night sleep. So how do you think that is going to be, this infection is impacting the sleep, and vice versa? How sleep is so important in such situations?
So if you see, when a child has any of these illnesses which worsen in monsoons, like a cold, cough, high-grade fever, body ache, abdominal pain, vomiting, they can cause delayed bedtimes because child is uncomfortable, can't sleep. Also causes multiple night awakenings. So overall, the quality, quantity, all are affected in sleep. Now, if a child doesn't sleep well at night, what is he going to do in the day? He will take a longer nap. They sleep at 6 p.m., 7 p.m., again it delays the night sleep. So they go into a vicious cycle. Also these days, many kids are home from school when they're unwell. What are they doing? They're on screen. Screen time delays bedtime even more. Now, if you sleep less, you're prone to your immunity even going down. So again, you're more prone to infection. So it just goes in a cycle. So I think, yes, little bit of change of bedtime routines and sleep hygiene is going to be there. Because the child is unwell, will wake up at 9. But try and stick to a routine as much as possible. And even if you divert from the routine, come back to the normal routine as soon as you can.
I think that's a very important point, that you need to have a proper schedule. Even if the child has infection, try to stick around to the schedule as much as possible. And of course, we are not here sitting just to talk about infection and how we can treat. We are here also to talk about prevention. So let's understand about what we can do for prevention. One is, I think Dr. Shilpa pointed out, nutrition and hydration is extremely important, and I would like to address it. When it comes to nutrition, it is extremely important that you think about including fruits, all seasonal fruits and vegetables in the diet, which means fruits like pomegranate, you have jamun, you have strawberries coming in, you have different fruits which are available right now as in the season. Those should be consumed more so. And vegetables, when it comes to more dark and seasonal dark, bright color vegetables will be more packed with vitamins and antioxidants, which you need to consider. Not to forget about probiotics here, because again, probiotics are important for managing your gut health. So you need to include curd, even though people think that curd can cause cough. That's again a myth that you should not consider. Freshly made homemade curd should be considered, rather than making it a day or two before and then keeping it refrigerated and then giving it to the child. Prefer putting it for fermentation in the night, and in the morning cut it fresh to give it to the children. Other than that, hydration is extremely important. We always talk about hydration only during summer so much that you need it. Even during any other season, hydration is extremely important, because the child doesn't feel thirsty, but the child is still losing fluids. So you need to include more fluids in the form of coconut water, buttermilk, maybe vegetable soups or chicken soups if non-vegetarian, because again, it's a warm fluid to take during monsoons, which is more preferred. So these things needs to be kept in mind, like rightly put, the child may be having urination and the urine color is changing. We are not knowing that the child is getting dehydrated. So we need to keep in account all these things, and of course to avoid too much of sugary and fizzy drinks in children, because again they may upset your gut and appetite as well. And going ahead with that, I would like to ask Dr. Shilpa Yadav that hygiene is a major concern, and you were talking about what other things that person needs to do to maintain good hygiene other than having non-contaminated food and water. So what are the 2-3 simple habits that parents need to keep in mind and inculcate in the children in the household for avoiding these infections?
Okay, again a good question. So what are the precautions that you would like to tell the parents during this season? Is boiling water is the gold standard. So whether you're taking water from the filter or whatever, filters with candles are completely outdated. So aqua guards and other things are probably there in every home, but boiling water is one important thing. Secondly, right, like you said, having more fruits and vegetables is something that you should be having. So cleaning them thoroughly before you consume them is another thing. Prevent eating stale food or cooked overnight, giving the children. So this is something that you would. Another thing that is very important is, like I said, when the child has got cough and cold, it is better to keep these children back home and not send them to school, because that's how the infection spreads. And if at all due to some reason the child has ended up in school, then basic things like covering your face, a handkerchief has to be provided. Covering, or a tissue. Tissue would be best, because you don't want to reuse those handkerchiefs and put them in different places where again it causes contamination of the surfaces. So this is one thing. And like we taught everybody how to cover your face when you're sneezing and coughing, or cough in your elbow when you're when you want to sneeze or cough. So these are and hand hygiene. So hand hygiene, by that I mean is when you use the toilet, that it has to be definitely inculcated that after you use the toilet, you have to wash your hands thoroughly. Before meals, you have to wash your hands thoroughly. Using sanitizer is not a shortcut to hand hygiene. That is for probably the hospital people who are in between the patients. But for the parents, it's a clear-cut message that there is no shortcut to hand hygiene.
Bang on, all the points in place. Just want to probably add that, you need to know how to store cooked food and raw food. That needs to be done separately. That's extremely important, again, to avoid any kind of contamination. Also, once you have, not to use stale food, because that will have bacterial growth faster on the food rather than giving fresh homemade food. Other than this, definitely there are other foods which are important that shouldn't be given, at primarily all seasons. I wouldn't say just monsoon, but yes, there are junk and processed foods that one needs to be avoiding. Everybody talks about bhaji and chai during monsoons, but really, is it the right choice, parents? No, it is not. So definitely you need to make and inculcate good habits of giving warm fluids and avoiding all kind of processed sugary foods during this season as well, like other season. Coming to Dr. Lat here, how can parents of newborn protect them from seasonal illnesses which are at home or which are going on?
Usually a newborn is a baby who is less than 1 month old, and generally they are breastfed. They catch up the infection more of a cough and cold from I already told, either from a mother or a person who is in the family or generally a sibling. So better way to prevent them, to keep them away from these sick siblings. And secondly, if the mother has got herself a cough and a cold, she can breastfeed the baby, but she can cover the face with a mask so that she cannot transmit the virus to the baby. So this is the better way. Getting a loose motion diarrhea is not possible in a 1 month baby because they are breastfed babies. Especially I want to stress babies who are preterm, who are born small, born less than 1 kg, this baby has got very high problem getting a respiratory infection because of change in weather. Usually after discharge, the first winter or first monsoon is little bit difficult for them because they are very prone to get a recurrent respiratory infection, and that can be prevented by giving the vaccination. Nowadays the RSV, I think Bafna sir is will tell about the vaccine, but for the preterm the RSV vaccine is available now in India. That is again in the small babies we will advise them before they go home.
So are there any specific guidelines, sir, for the infants, or what is the gist of the guidelines that you just mentioned?
Yeah, these are not guideline in sense, it is advice to all the parents. So especially in the babies, there is no as a clear-cut guideline, but Indian Academy of Pediatric has given the guideline how to take care of a baby less than 1 month old and less than 1 year of age.
So with definitely monsoon, we also have humidity which increases, we know. Definitely with humidity comes wheezing. And then again with children with asthma, it becomes a more tricky situation there. So I would like to ask Dr. Bafna, so how exactly does monsoon humidity impact children with asthma and breathing issues? Any practical tips for the children to manage it?
So, as we all know, asthma is basically a condition where you have your airways which get affected, or they react adversely to your aeroallergens or allergens present in the air. Those are at home or they are in the atmosphere. So these are this is how you get asthma. But the most common reason in children for getting wheezing or asthmatic type of symptom is viral infections. And we have already discussed that viral infections increase during the monsoon season. Therefore, the propensity to wheezing, propensity to asthmatic symptoms is bound to go up in those children, those who have some propensity to develop wheezing. The chances are going to go up because the infections are going to increase. Apart from that, another important factor which is an important trigger for asthma is change in climate. Rather than humidity, I would say sudden change in climate, temperature change, whether it is from summer to winter, winter to monsoon. This is also hazardous for these children. Third thing is humidity. Coming to humidity, I think again it is related to climate change, but another important point for humidity is the most important aeroallergen for asthma is house dust mite. The dust mites which thrive in the your dust, and that dust is what we call as not construction dust or any other pollution related, but dust which is present in the house, which is in your carpets, upholstery, beds, linens, all this. And these bird mites, they thrive more during humid climate, and that's how their growth would increase, and they are the most common trigger for asthma, and therefore that's how the asthma attacks would increase in patients who have allergic asthma during humid climate, and they would increase in non-allergic asthmatic because of viral infection. So it's monsoons would have more wheezing episodes. That's how it happens.
I think it's a very important point to be noted, parents. Coming to again our toddlers, Dr. Lad, we have all seen rising cases in dengue and chikungunya during this season also. So how do the parents really suspect that in these kind of infections in the babies or the toddlers?
Yeah, the main thing about dengue and chikungunya is the stored water. The dengue viruses get transmitted. Usually, is by the mosquito called as Anopheles aegypti mosquito, and these mosquito bites the children, especially in the evening. So we need to make sure when there is a rainy season is coming, you make sure there is no stored water. So if there is a stored water anywhere near the plant or in the home or outside, that can harbor the virus. Mosquitoes, and that ultimately carries the viruses, and that viruses get transmitted in the babies. So chikungunya and dengue is relatively not good in a children less than 1 year of age, because they cause more dangerous issues in these children. Last year we had epidemic of chikungunya in India, and we have lots of cases has been reported which are unusual presentation, who develop with a liver failure, brain infection, convulsion, heart problem, has been reported by our institute at Jehangir also. So this year I think we need to be more proactive to not to get such infection, and especially these children get a very high grade fever, rash, which is not responding to the treatment, sudden lethargy, and these manifestations start showing in the children, is better to consult the pediatrician.
So do you think they will probably need a pediatric ICU, and what is your experience in managing such cases in the ICU?
See, all the dengue doesn't need admission, or all chikungunya doesn't need admission. Chikungunya is thought to be very benign disease previously and not causing any problem, but last time we have realized is very problematic problem. Even a dengue doesn't need, all the dengue needs admission, no, especially in the babies who are small, less than 1 year, they go into a random phase of called as a leaky phase, where the baby start getting a swelling in the hand, BP goes down, and the child become unwell. Even if a dengue child become so much of a sleepy is not a good sign. So one way it is not that all dengue are sick, or it is not like that all dengues are well. I think the pediatrician is a better person. So if you get any suspicion, don't get frightened that my child has a dengue, oh God. So it is nothing like that. If you do a proper monitoring, proper hydration, proper feeding, good urine output, good sleep, good food, generally settle down. If your child is spiking very high fever for 3-4 days, almost going 103, 104, not coming down, not settling, definitely the dengue is little bit dangerous. It's better to consult a pediatrician, and in Jehangir we have a well-equipped pediatric ICU care unit to look after all these sick children.
Excellent, sir. I would say, it is the season of water everywhere. Everywhere that you see, whether in food, whether on yourself, whether on things that you don't want to see water, you see water around. So it's definitely waterborne illnesses which are also peaking at this point in time. I would like to ask Dr. Shilpa Yadav that how would parents protect kids from these infectious diseases like typhoid and hepatitis A? Can you address about, because these are all due to contaminated water?
Okay, I think most of the questions you have asked I've already answered. Is boiling water. Basic thing is boiling water, not eating food outside. Third thing is having freshly cooked food. Fourth important thing is vaccination. I think in all this melee of discussing what the monsoon infections are, we should give enough priority to right time vaccination is the crux. So I would just like to add one thing here, leaving aside the monsoon melodies, is generally when summer starts, the parents come to us that kal se swimming jana hai, aaj typhoid hepatitis A de kya? Very common question and very common problem that we face in the OPDs. So I would tell all the parents out there that when you plan to put your child for a swimming class or any of these kind of water activities, at least 6 to 8 weeks prior to joining a swimming class would be the right time. As coming to the respiratory infections, yes, flu has changed the picture completely. 9-10 years back when we had the H1N1 infection, I think we were all worried like we were during the COVID times. But the flu vaccine has changed the scenario completely, and now we do get flu infections. Yes, we do get, but they are not of the same intensity, requiring admissions and ICU managements that we used to get before. So yes, up to 5 years, the Indian Academy of Pediatrics does recommend routine flu vaccination yearly. But if your child falls into any high-risk category and having any kind of illness, then it is absolutely okay to give vaccination even after 5 years. So then the onus lies with the pediatrician, the treating pediatrician, whether we should be giving flu shots. So along with this, typhoid, hepatitis A, like Dr. Sagar has already said, respiratory syncytial virus injections can be given. Also, I don't think we have something in the pipeline for chikungunya as yet. Dengue again.
That's what I think. We don't have anything for dengue and chikungunya. The rest we have a vaccine. But till then, I think it's the onus of responsibility as an individual and as a community to take care of stagnant water, because both these illnesses
Absolutely.
are preventable without a vaccine if taken care of. But I think as a society, it's not being done enough. We are talking more about how do you treat, what are the complications, but prevention, where is the prevention? And I really think we need to look at preventing these diseases now.
Yes,
on a larger scale.
and another thing that should go very strongly across is prevention is not the onus of the hospital, the doctors, and the paramedics. It is an individual responsibility. Every person should be geared up to, not having puddles of water around you, having ACs and coolers with water inside there, having tires and containers, potted plants. Having water contained in them. So it is a collective responsibility. So I think the message that goes is you have to change yourself, then probably.
Hello. Yeah, I think that's extremely important, and these are the important points that one needs to make a note of. These things like pods, like your coolers, your ACs where your water is getting accumulated, etc., needs to be kept in mind. So please make a note of all these things. And again, a very underrated medicine, which is sleep. We need to talk more about it. So definitely I'm going to ask you one more question on that. The doctor, how does sleep support recovery from these kind of infections? When it comes to recovery, how does it really help? And what do the parents really do, especially during illness? I mean, you have spoken about it in bits already.
Again, I repeat, like sleep has a very important role in immunity. So actually when you sleep, all your immune system sends all its warriors to help you fight the bug. And if you've noticed, when you're ill, you feel more sleepy because that's what your body needs, right? So many patients come in this season and say, our child is getting a cold every month. Any syrup for immunity building? Well, there is no quick fix. There is no syrup. But yeah, there are a few things which really help the child. One is like Dr. Yadav said, good food, hydration, you said about food. And third is something which is not given much importance is sleep, sleep and sleep. And sleep really helps in immunity. And even they say 1 week of deprived sleep makes you more prone to infections. So please be very, very, very strict with a very good sleep hygiene in your children.
Excellent. Hello. Yeah, excellent and very well put up. I think we've covered almost all the aspects of infections during monsoons in children, whether it is infants, whether it is toddlers or kids. I want to now just give the mic to each of our experts for a quick tip for the parents to take away. Just a quick tip for the monsoons for them.
To summarize, I think it is prevention which is more important than treatment. And prevention, we have already spoken at length. We are talking about nutrition, hygiene, vaccination. These are the preventive measures, and I think they should start quite early in life so that these practices go on. Second is to realize and recognize danger signs. I think, as we said, don't get frightened by the panel discussion. These infections, serious infections, are rarity. What we see is common. And what is parents' role is to recognize and realize what is severe, and this is, I think, which should be picked up at home. So danger signs which we have discussed, like breathing difficulty, high-grade fever, persistent cough, persistent fever. So anything which is going beyond 48 to 72 hours, I think medical attention and not over-the-counter medications. That's, I think, the message. Thank you.
I think I agree with everything that Dr. Bafna said, and just a bit that I would just like to add one thing is there is no such thing as preschool vaccination, but I would like to include that as a statement because that is a reminder to the parents for those children who are asthmatics or have recurrent infections to go in and meet their doctor before the school starts to give them the flu shots. So we can include this. And I think we missed out totally the MMR and chicken pox, which should be given along with all these vaccination. Most of it, I think Dr. Bafna has covered. I think I would just reiterate what he said and hand over the mic to Dr. Sagar.
Quick tips, please.
As Bafna sir said, don't self-medicate. If baby is not well in 24-48 hours, best person is go to the pediatrician, not take over-counter medication.
Fantastic.
I have only one tip. Sleep is a very powerful immunity booster, so focus on sleep. And another thing, like Sir said, we have more instances of asthma, allergic rhinitis, which disturbs sleep. So please don't be apprehensive of taking preventive treatment for these illnesses, because if you're going to have a child who's sick every month and you're scared to give a preventer, you will have distorted sleep and other issues. So please focus on that as well.
Excellent. I think we've covered all the points, and I'll just add one quick tip again by saying include warm, include fresh home food, and don't forget about the activity, physical activity, which is important. Reduce on the screen time, keep yourself clean and hygienic, and try to drink clean, safe water and food. That's about, I think, from all of us. I would like to thank all our experts for their practical insights. Thank you so much for joining in, our audience and parents. We have a wonderful team of pediatricians at Jehangir Hospital and a clinical nutrition department. So any doubts or any worries that you have, we are here to help. So thank you so much for joining in today. Till we see you next time.